Hello all, my name is Paresh Naik. I am an ENT surgeon practicing in UK. Today, I am going to talk about a routine practice. A routine but very crucial element of our practice, consenting. Consent. So, what is a consent? By definition, it is a document, a written record that a patient has agreed to the planned operation. There is also a term called verbal consent, but this verbal consent must be documented. That is, you must record so and so discussion was done and the patient agrees or disagrees to the procedure. But actually, it is just more than a record. It is a communication and discussion of the treatment plan. It is communication to discuss the pros and cons of the surgery. It's a communication to discuss and establish a trust between the patient and the treatment provider. The doctor will discuss what the operation is likely to involve, the benefits and risks, the type of anesthetics and alternative treatments. It's not just discussing the complications and write it down and get a signature, but also we have to discuss the recovery period. Will the patient need time off from work? Consider we have a lorry driver who had a CSF leak and needs a repair. The patient will require post-operative bed rest. So the question is, how long the patient will stay away from work? So we will write the main benefits and risks associated with the surgery on the consent form. What are the questions that patient can usually ask? Why is the operation necessary? What does it involve? What are the benefits? Or what will happen if I don't opt for the surgery? What are the risks? Will the operation change the way I look? Are there any alternatives to the treatment? What are the risks if I decide to do nothing for just time being? And also there are questions related to anesthesia. Will it be general anesthesia or local anesthesia? What type of anesthesia is best for me? Is there any other anesthetic complications which are involved? Obviously, anesthesia side will be discussed by the anesthetist, and you can just briefly cover what is needed. Also, how will I feel afterwards? One important thing that we have to discuss is the stay in the hospital. How long will I need to stay in the hospital? What should I bring to the hospital? And what should I expect to feel after the procedure? Will I have nose block for the nose surgery or ear block after ear surgery? Most importantly, the pain. How long should I experience the pain? Will it subside? How many times should I take a paracetamol tablet, or do I need to take morphine? This kind of questions should also be discussed. It's a long discussion and not just a formality. It's good to be transparent and educate the patients, and also to make them understand what they are going to have. Thank you for listening. Hope this video has helped you.